So does PEMF need to be used with breaks? That's still a hugely outstanding question. Most research studies are done for practical reasons. They have limitations and protocols that are designed for practical reasons. And they have to do with people being willing to do the treatments, people coming back and forth to treatment to a clinic or to a research center. And so we don't know how much is needed. I mentioned already the non-union fractures. They're getting treatment for 12 hours a day. Why do you take a break? Well, I think taking a break is important because what you're doing with magnetic fields is you're stimulating all these processes in the body for tissue regeneration. What you're doing is rolling a rock down a hill. What magnetic therapy is doing is starting that rock rolling. And the rock rolls on its own till it's done, till it's at the bottom of the hill. So a magnetic field effect then basically is going to be like that. It starts a process going. How long that healing process goes depends on a whole host of factors, none of which are totally predictable. So I do recommend pauses or breaks in order to let the body finish the job of what it was trying to do rather than forcing it to move faster than it can. Again, magnetic therapy doesn't do the work. All it does is gives the body the energy to do the work that it needs to do itself. So its own systems can get exhausted, can run out of juice, can run out of energy to do the job that needs to be done. I have no hard and fast rules about this. I do generally say that there are people with extraordinary complex problems, multiple areas of the body with horrible arthritis, and they may need to, if they're very disabled, they may need to treat for an hour at a time. So an hour, I think, is a reasonable amount of time. On the whole, no hard and fast rules. Sometimes at the beginning of a course of treatment, you may need higher intensity treatments. And then gradually you spread out the treatments. You decrease the time, you decrease the frequency of the treatments. I don't mean frequency of the magnetic field, but how often you do the treatments. Part of that's still going to be a trial and error thing. I'll give you another example. Using the micropulse as an example, my wife actually broke her toe. It was out like that at an angle. And it was purple, black, blue, and of course painful. So the traditional medical approach to this is you buddy tape the toes. You put tape over the two toes to brace it. It's just like a cast in a sense. And then you put the foot in a platform shoe, a very flat shoe, sometimes wooden, but just something that's not going to bend, not going to flex. And then they wear that until the fracture is healed. What do you do to accelerate the healing of the fracture? Nothing. You wait for the body to do the healing work. You cross your fingers and say, okay, good luck. Let's go see what happens. See you back in 2 weeks. So what we did is I buddy taped her toe, put her in a platform shoe, and then got her to use the micropulse continuously, 24/7. So midday, the fracture, black and blue swelling. Next morning, she woke up, no swelling. Black and blue, bruising is gone, completely gone. Pain is completely gone. So did it for another 24 hours. The following morning, she, again, no pain, no swelling, no bruising. She walked a mile in tennis shoes. Did it another 24 hours. The next morning, so the third morning now, or the third day, so the second morning, third day, she's now walking 3 miles in tennis shoes. And that was the end of the story. Normally, clinically, I would expect that foot to take 2 to 4 weeks to heal. That's normally. And my question for people is, why do you want to leave things to chance? Why not stimulate the healing processes of the body? So in her case, she recovered extremely rapidly by doing magnetic field therapy continuously for 24 hours. Now, does every problem need that? If you have hip arthritis or if you have shoulder tendonitis, 24 hours a day is probably not necessary and may not be any more helpful. Then you can't accelerate the body beyond its capacity to generate its own healing. You can give it more energy, it will go as fast as it can, but it's not going to go any faster than that. So in other words, the healing curve is not like this. The healing curve is going to be like this. All right, so do you need to take a week off? The question is, what are you treating for? If you're doing health maintenance, why are you doing health maintenance? You're doing health maintenance so that you don't age, right? That's one of the primary reasons. Or you got a health problem that you don't want to get worse, so you keep treating to maintain it at least at that level so it doesn't get worse. That's a good example of that is osteoporosis. You may not be able to recover bone, all the bone you lost, but at least you stop the progression. So stopping progression is a win. So how much time do you need to treat for? Your body's going to tell you. I don't know. It's very, very hard to overdo it unless you're using extremely high intensity magnetic fields, or your body's telling you, I don't like this. Animals like PEMFs, and they get off when they think they've had enough. You know, sometimes we say, well, the doctor said I got to do 24 hours, so I'm going to do 24 hours regardless. My body's killing me. This is hurting. This is making me worse. Well, don't do that. Listen to your body. Let's respect the processes of the body to do their own healing work. You're giving them a chance. You're giving them the energy to work better, harder, and longer. So let's respect that. So you're going to have to take that feedback from your body. That will tell you how often you should take breaks. So you don't need to take breaks, what I'm saying. You don't need to take breaks. You may need to take breaks during the day. Well, for practical reasons, you're going to take breaks. You don't use it when you go to the bathroom. Well, maybe you do. But generally speaking, you're not going to need to treat 24/7. There aren't that many problems that need to be treated 24/7. And if they do, you start off maybe 24/7. Then after a few days, as you start to feel better, as you feel the healing happening, then you back off and you see whether you can deal with less time. Now, are you going to go from 24/7 to 2 minutes or 8 minutes? Probably not. So the symptoms may come back, and the symptoms, when they come back, they'll tell you, well, it's time to treat again. So if you have a pain and you treat, and the pain you treat for say half an hour or an hour, and the pain goes away for 4 hours, then what do? Probably should treat again at 4 hours. Well, if you can't, you can't. Then the pain's going to come back, and you know the pain came back. Then you treat again when you can for as long as you can. So that kind of process of treatment, so letting the pain come back, is not going to get you the best results. It's still going to work better than nothing, and it may over time actually increase the amount of time it takes for the pain to come back. So listen to the body, and as the body tells you the pain's coming back, well, that's probably a good time to treat. If you do that regularly for a while being days to weeks, months, possibly even, then that could extend to 8 hours. It could extend to a week, right? Your body's going to, as the healing happens, the amount of treatment time may decrease. So it really depends on what again, go back to the question originally, it depends on what you're treating, what your goals are, and the kind of magnetic system that you're using.